Many of the times we experience difficult situations, difficult circumstances, tough emotions. It is not always that you are able to handle it. So sometimes there are childhood traumas, sometimes some situation suddenly comes up and you lose control of what you are, okay, and you go in a different direction because of any kind of trigger. You experience anxiety, depression, or could be several different other emotions. Feel that we are not in a position to take care of ourselves. First thing could be to tell your near and dear ones. It has a problem. Sometimes you may not be comfortable enough. Even if they are your family and your friends, you may not be comfortable enough to share the deepest pain and desires. And if you share, there is a high probability that there could be a bias, because people whom you tell, they already know you. They have seen you growing up, they have seen your habits, so they have formed a kind of impression about you. Whatever suggestion or feedback they may give, their bias can get in way of that. That is where therapy comes into play. It's called psychotherapy, but I will refer to it as therapy throughout the video. Okay. A process of treating mental distress or psychological disorder using verbal techniques or psychological techniques, whichever is applicable. Usually there is a person who is qualified psychologist or psychotherapist. He or she listens to you, rapport building, relationship building, and healing happens, okay, whatever your situation is. Today's video would be a guide all those who are thinking of taking therapy. What all things you need to keep in mind if you are going there for the first time. If you have already taken a therapy, then if you want to know what is it and how does it work, primarily getting a solution to whatever emotional problems that you are facing. Hopefully this video will help in that, and without further ado, let's begin. Should be kept in mind is anonymity is the main principle. Therapy is a safe space to express your emotion, to vent out whatever you are feeling, and to be assured that it does not go beyond the closed doors. If it's in a room, it will remain with the therapist over there. Does therapy work? Yes. I have seen people who have taken therapy and have had considerable difference. I have taken it myself. Whether it is offline or online, that you need to think. My personal preference is offline. Feel there is a kind of wall that I hit if it's online. At least for the first time, choose offline, and then you can go online from there if that is an option, or online also is fine. Main thing is getting a solution to your distress, okay, that is the main thing. Whether it is offline or online, it doesn't matter. Therapists are trained personnel to diagnose and to treat mental distress conditions or psychological disorder through verbal communication. All psychotherapy starts with forming a relationship with the client, having a good rapport, communicating and creating a dialogue, and working to overcome problematic thinking or any kind of distress situation. Therapy could be of 4 types. Individual therapy, where you are a single person and then you approach your therapist. As a couple, if there are any kinds of relationship problems with couples, then they can seek solution. Family therapy, dynamics within family are monitored. And 4th, group therapy, where small group of individuals which have a common goal, they seek therapy, okay. It may or may not be from the same family. So what kind of conditions are treated usually? Anything and everything from anxiety, addiction, anxiety, bipolar, depression, okay, you name it, and there will be some sort of psychological aspect associated. I've seen hospitals actually recruiting psychotherapist and therapist as a part of their medical team, though that time is gone now, where physical illnesses used to be treated by one doctor, psychological things were separate. We are moving into an era where holistic wellness is considered more. So even whatever hospitals they are there, they have vacancies and personnel to deal with any kind of psychological issues that may arise while treating their patients. How is it that psychotherapy has some kind of benefit? How can just talking help in alleviating your mental conditions? Whatever mental distress is there, it happens because of unexpressed emotions where you feel that there is nobody to talk to, there is no support or any kind of such thing. Communication, okay, and communication in your favor. Your therapist is there to support you. He or she is not there to question your decisions. This element of empathy is the first principle of any psychological therapy. We feel that we are like this, we are experiencing anxiety, this and that. But what are the underlying triggers? It could be something that has happened in your childhood that has affected you so much that even if there is slight memory, there is anxiety. It could be some form of assault that you might have gone through in the childhood, some kind of parental issues. We feel that this is the problem and this is the solution, but that is what you think. There could be several layers beyond it, and that only a therapist will diagnose. Something that could be triggering you, that will affect you and make you behave in a certain way, and you are not aware of the triggers. That awareness is not there, then obviously you will continue to behave in the same direction. So that awareness therapist will get you. Let's take an example. If, say, suppose there is a person, and whenever you see that person, because of whatever behavior, you get angry, then it's not that the person is triggering you. That person's behavior reminds you of something that has happened with you before. You are reacting to that trigger which has already happened in the past. Okay? This is just an example, but that is what I want to explain. That's where therapy comes in. Then the next benefit is improved communication skills. Once things are smooth and resolved, obviously communication skills become better. Healthier thinking pattern and greater awareness. You know your triggers, so whenever you are provoked to anything, you know that this could lead to something else. So you are aware of that and you can take steps to overcome that. Greater insights about your life. Say suppose you are doing a task and you are procrastinating on it. You are very productive otherwise. So there could be some kind of resistance with that task which is tied to some memory or something of that sort. So it is not that you are lazy, it could be because it is triggering something that has already happened before, okay? Or it reminds you of something that may happen in future, okay, some kind of negative impact. Then better coping strategies. Whenever I used to get stressed, I used to keep having sweets or any sugary thing. In our subconscious, we come up with several coping strategies. So that could be one of the coping strategies that my subconscious had formed, but it is an unhealthy one. Therapist will give healthy coping strategies for you, and obviously stronger family bonds. If you have any kind of problems in your family, whatever it is, for no fault of yours, it helps you make peace with the situation and takes you at a level where you know that things are happening, but it will affect you to a very lesser degree, and with further advances it will not affect you at all. I always feel going to a therapist is like going to a salon. Some salons you will like, some salons you will not like. Just if you go first and if you don't like the person in first meeting or something, that does not mean that therapy is not for you. You can approach a second counselor. How to get the most out of psychotherapy and what all you need to be aware of. The first thing that should be taken into consideration is that being honest. It's a safe space, so whatever you say and whatever it is, it will not be judged. Free to exercise your emotions. You are not telling a part of the story and hiding the other part because you feel you will be judged, but that is not the case. Whatever your negative emotions are, the ability to feel it is important. Whatever jealousy, fear or anything, everyone has those emotions, or nobody is free from it. As long as we are here, we have not attained any kind of liberation, so might as well accept that these feelings are there. Actually, these feelings are the ones which will help you in understanding what your triggers are. there are some emotions like anger, okay, it is a secondary emotion. Secondary emotion meaning the expression is anger, but the underlying emotion is grief, sadness. It gets expressed as anger. Being regular, attending the sessions regularly is important with anything, with diet or workout, anything. Consistency remains of paramount importance over here. Whatever the homework the therapist gives, okay, you may feel that it's a very small exercise or anything. Later you will realize the importance of it, what a crucial part that the therapy can play in your life if you do it right, okay, if you follow whatever instructions your therapist has given. Don't see results, then you can see somebody else. But for the time period that you are in therapy, follow it rigorously. How do you know if you need therapy in life? Okay, if you are relying on dangerous coping mechanism like any kind of addiction, any kind of overeating pattern which is there, we feel you are overeating is a symptom. Okay, the underlying is some form of trigger or fear or anything that only a therapist can tell. If you are facing any kind of distress in your personal or professional life, it's making you overthink, it's affecting your productivity, and even if it's not affecting your productivity, you are able to do all the tasks properly. But internally you are always overthinking. If you are getting feedback repeatedly from your family, well-meaning friends, they are seeing some kind of change in you. If you have lost interest in life, any kind of change which is on a negative side or on a neutral side which was not there before, with respect to your emotional pattern, then it's time to seek therapy. So the first thing to understand is whether you want to go for offline or online, as I said. As far as online is concerned, BetterHelp and Precto are there. There could be some other platforms also. I know of these two. If you don't know where the therapist is, or if you are struggling to find a therapist, what you can do is you can visit a nearest hospital or your family doctor or a nearest doctor, general physician, and they usually have the contacts of therapist. Okay, how to choose the right therapist? First, primary thing is qualification. Okay, that does not mean that all those who are qualified are good therapists, but your starting point can be qualification. How comfortable are you? Your comfort and your I remember when I had started out, one therapist that I approached, I had made it clear that my sessions would be in the morning. After a couple of sessions, somehow I was given evening sessions which was not the way I wanted it to work. So then I had to shift and change to some other person. Which timing are you most comfortable with? Okay, stick to one timing. Let the therapist expect that you will be there at that time, so he or she can prepare accordingly. Some therapist might ask you to give a disclaimer that whatever thing you are taking, it's with your interest, under no force, whatever disclaimers, but that is completely fine. It is just a part of the process, only the start of the process. Don't be afraid to try out different therapists. Psychotherapy is both an art as well as science. If you don't click with any person, then you can change the person or move to, but don't give up on therapy just because the therapist is not good. And getting a resolution to your problems is of utmost importance. I would suggest, if you are facing any kind of emotional distress because of anything, anyone or any situation, I highly recommend therapy. You'll be fine, and all the best to you.